It would make sense that if you want to improve the facial structure of someone or if you want to prevent a lot of issues later on, that it would be best to do it as someone's jaw is still developing and before they hit puberty. So as early as possible. There was a dentist by the name of Dr. Weston Price, and he was practicing in the 1930s, and he was investigating the cause of facial changes and crooked teeth in different countries and different civilizations, and he found some interesting results. So he visited the Gaelic people living on the Hebridean Islands off the coast of Scotland, and he found that children started becoming mouth breathers after their parents switched their diet from their normal natural diet, which was seafood and oatmeal, and they switched them to the more modernized diet, which was angel food cake, white bread, other types of white flour, marmalade, canned vegetables, fruit juices, jams, and confections. Just sounds unhealthy, right? So it's pretty evident that for a lot of people that have crooked teeth and narrower faces and smaller jaws compared to our ancestors, that they have become mouth breathers, and this mouth breathing is what has contributed to a lot of these anatomy problems. And the thing is that these changes in our diet and other changes, they'll affect our breathing first, and that will in turn lead to a whole downstream of other issues. So it's estimated that right now 50% of children are mouth breathers. And I can tell you that in some communities that is way higher. For example, my patient population that I see, I would say about 70 to 75% of the people that I see, especially the children that I see, are probably mouth breathing. And there's some very clear-cut signs that will tell you that. Now, humans were meant to breathe through their nose, and pretty much any animal is meant to breathe through their nose, and we're the only animal that does not breathe through our nose regularly, especially westernized humans. And when we are breathing through our nose, our tongue is supposed to be resting against the roof of our mouth, or in other words, the palate. And when our tongue is resting against the roof of our mouth, especially as we do this at an early age, our palate will kind of follow the shape of our tongue. And this tongue provides a stimulus for our palate to grow. So when our tongue rests against the roof of our mouth, it will stimulate our palate to grow forward and grow wide. So this is why so many of our ancestors, and why pretty much none of them had narrow jaws, because they were all nose breathing and they had correct tongue posture. And this is why their airways were so open, why they were able to breathe so much more efficiently than us. Because instead, when we become mouth breathers and our mouth is hanging open, our jaws become more narrow and our tongue never touches the roof of our mouth and our palate never gets that stimulus to widen and to expand. And our jaws stay more receded because they do not grow forward, and this will constrict our airways, constrict our breathing, and also not give enough room for those teeth to come in and cause those crooked teeth. So it makes sense that if you were able to correct these changes early on in a child, that they may not ever need braces, and they may not ever have a breathing problem like sleep apnea or snoring, etc. So what else causes us to become mouth breathers? We talked a little bit about the diet, and I'm going to talk more specifically about how the diet can contribute to us becoming mouth breathers later. But other issues are having airway blockages, so like enlarged tonsils and adenoids, which is basically these lymph tissues that are in the back of your mouth. Also, nasal septal deviation. So if you ever broke your nose or have a deviated septum, this is another reason. Also, being tongue-tied, we've talked a little bit about that, but basically when your tongue is glued to the floor of your mouth. Also having allergies or nasal congestion could also just be habitual. So if kids grow up and they have none of these problems, but they habitually see their parents breathing through their mouth, they're going to try to copy them. That's what kids do. They try to copy people around them. That's why you're not supposed to swear in front of kids. But they can habitually copy them, and then they can start mouth breathing. The interesting thing is, a lot of these reasons for becoming a mouth breather can be corrected by simply using your nose to breathe. You might be looking at me like, well, I have a deviated septum, so how am I supposed to correct that by breathing through my nose if I can't even breathe through my nose? Well, 60% of people have a deviated septum, but a majority of them are still able to comfortably breathe through your nose. So just because you have a deviated septum, it doesn't mean it's the end of the world and you cannot breathe through your nose. Obviously, there are some exceptions, and I can get into that more in a different video. But also, for example, if you have large tonsils and adenoids. That can be prevented by breathing through your nose. If you breathe through your nose at an early age, your body will produce a molecule called nitric oxide. And this nitric oxide is an antibacterial molecule that can help prevent these tonsil and adenoid infections. And also when you breathe through your nose, you're more likely to engage your diaphragm. So your diaphragm is this muscle that rests underneath your lungs, and you should be engaging this every single time you breathe. And I can get more into doing that in a different podcast. I'm not focusing on that exactly right now. But when you engage your diaphragm, that also drives the lymph in your body. So your tonsils and your adenoids are these lymph tissues in the back of your mouth. And when you engage your diaphragm, it starts to drain the lymph out of all the tissues, including your tonsils and your adenoids. But instead, when you do not use your diaphragm, then you're not able to drain that lymph, and those tonsils and those adenoids are more likely to get swelled up. So you can see why simply breathing through your nose more can prevent a lot of these issues that cause someone to become a mouth breather. So as I said before, with kids, their jaws are still developing, so it's really important to enact any changes early on. But before you do any of these changes that I'm going to recommend, make sure you talk to your doctor about any suggestion and talk to them beforehand and see if this is a safe thing to do with your child. So really correcting tongue posture and correcting your facial structure and preventing issues like having a narrow mouth can be started as a newborn. And we can even argue that it can be started as the child is in the womb. But one simple thing you can do with the newborn is something called neurostimulation. And this is a way to encourage the child to have their tongue up resting against the roof of their mouth. So all you have to do is rub the baby's tongue and rub the roof of their mouth. And that baby will be inclined to start touching the roof of their mouth earlier on. That is a simple trick you can do to encourage babies to not only breathe through their nose, but also have correct tongue posture. Also, another really important thing for the tongue specifically is breastfeeding. So breastfeeding actually encourages the tongue to be in an up position and up against the roof of the mouth. And also, as a baby is swallowing when they're breastfeeding, it forces them to use their tongue to swallow. So they have to use their tongue to get milk out of the breasts, and they also have to use their tongue to swallow. So this is really good for a baby's tongue posture. So right now, the American Academy of Pediatrics recommends breastfeeding until about 2 years old. I think this is a good age to keep doing it so that you keep that baby having proper tongue posture. Now, just like breastfeeding is super important, it's also super important to avoid using bottles, sippy cups, pacifiers, and avoid the child from thumb sucking as much as possible. All of these things are going to be doing the exact opposite of breastfeeding, where breastfeeding actually encourages the tongue to be up against the roof of the mouth. These things are actually going to force the tongue to be down and away from the roof of the mouth. And the more a child does this, the less likely they're going to keep that tongue against the roof of their mouth when they're resting, and the less likely their jaws are going to expand and allow for all their teeth to come in the right place and allow their airways to be open. Now, I know that's easier said than done, right? Because I know a lot of people that have babies and they try all the right things, but the only way they can get them to stay quiet is allow them to suck their thumb. Now, it does take a lot of work, but I would strongly encourage to stop this at least by the age of 3. If you can stop it earlier, that's even better. But if this continues after the age of 3, then they're really likely to have a lot of these postural problems, really likely to have a constricted mouth, and it's going to be so much harder for them to correct this later on. Now, sometimes babies can develop a tongue tie. Now, I talked a little bit about tongue ties in adults, but sometimes we can get these in babies as well. Now, usually if a baby has a tongue tie, they will usually clip it as they're born and allow that tongue to have some freedom. Now, this doesn't always work because if you just release a tongue tie but you don't do anything with it, then that tongue tie surgery is going to develop as scar tissue and that tongue tie is going to come back. So you want to make sure that if you do get a tongue tie, so if your baby does end up getting a tongue tie released, that you encourage the baby to do all of these exercises because you want to make sure they're really using their tongue. It's really important. So I gave some exercises already for adults, but if a baby has a tongue tie and it's not released or it comes back, then it's going to really cause some issues. So one thing could be that they can't even latch on to a breast, so they can't even do breastfeeding. So this is not only going to cause problems with their nutrition because they're not going to get the benefits of breastfeeding, but they're also going to struggle keeping their tongue against the roof of their mouth. And now they're going to be more likely to have breathing difficulties and narrower jaws. So some things to check on a baby and see if they are able to use their tongue properly is, are they able to stick their tongue out past their lower lip? That's a good sign if they can. If they do stick their tongue out, do you see a V-shaped notch, or is it kind of rounded, how it's supposed to be? If you see this V-shaped notch in their tongue, then that means that their tongue tie is pulling too hard against their tongue. Also, if their tongue tends to curve downward and extended generally throughout the day, if they have trouble swallowing things, if they have speech problems, all of these things are going to be contributed to by a tongue tie. Now, another important thing to do with a child to help with jaw development is to start feeding them harder foods starting at 6 months old. Now, again, you want to make sure you run this by your doctor to make sure that whatever you're feeding your child is okay. But a great example is carrots. So carrots are very nutritious and they do require some chewing. And these are things that can help develop our jaw muscles and help develop our bones by actually chewing on these foods. I prefer this over all the mushy, softer foods that people tend to give their kids because those foods, yeah, they're feeding them, but they're really not doing anything with their jaw development. And then they're going to further be more likely to have these issues later on in life. Now, another thing that's really important with children is to avoid processed foods. So I mentioned Dr. Price's discovery earlier in this video, and he may have found the link between our modern diet and chronic hyperventilation. Hyperventilation is where you're basically over breathing, where you're breathing too much. So this happens when you are a mouth breather. When you're a mouth breather, you are always over breathing. Anytime anyone is a regular mouth breather, they are chronically going to be an over breather. There's no ifs, ands, or buts about it. So I can talk more about over breathing on a different podcast, but basically, throughout our evolution, our diet has been 95% alkaline or basic forming foods and 5% acid forming foods. Nowadays, it's the exact opposite. So acid forming foods are foods that form more acid in our body. So that's going to be processed foods, going to be bread, sugar, coffee. All of these foods make us more acidic. And in turn, when we're more acidic, we're more likely to breathe faster. Because the goal of exhaling, the goal of breathing out is to get rid of excess carbon dioxide, excess CO2. As our CO2 builds up, this produces more acid in our body. So the more CO2 we have, the more acidic our blood is. So if we artificially make our acidity level higher by eating these processed foods, it's going to increase our breathing. Because, like I said, the goal of breathing out, the goal of exhaling is to get rid of this excess CO2. And the key word here is excess. Because if you get rid of too much CO2, then this is going to cause a lot of downstream problems, and this is going to contribute to mouth breathing and contribute to all the negative effects we talked about. So instead, it would be better to eat more alkaline forming foods. And this is true whether you're an adult or a child, because the modern diet is terrible. The modern American diet, you can see there's so many processed junk out there that is just not good for us. So adding more fruits and vegetables and even plain water. These are the three most alkaline forming foods that we have. And these are things that can actually control our breathing. So I'm not telling you to become a vegetarian because meat is still okay as well. Meat is still good for you. You need to have protein, but you want to make sure it's not processed meats. A lot of the people that eat meat, they eat these deli meats or they eat these jerkies or other meats that are super processed, and those are going to be foods that are not good for you. They're going to form more acid in our body, and they're going to increase our breathing rate and cause all these downstream effects that come from mouth breathing. So in a nutshell, what are the best ways to properly develop the jaw of a baby? Well, we talked about breastfeeding. We talked about proper tongue posture. We talked about proper breathing, how there should be breathing through their nose. And we also talked about their diet. So avoiding processed foods, avoiding acid-forming foods, and adding more alkaline-forming foods, and adding more hard foods that they have to actually chew on. Now, the second thing that light does is it can shift our circadian rhythm. So in a nutshell, if you get light exposure in the morning, this can advance your clock. So this can make it so that you want to fall asleep earlier. And if you get light exposure at nighttime, this can delay your clock. And this can make it so you want to fall asleep later.